If you or a loved one is dealing with knee arthritis, you might be considering this procedure and wondering if it's the right choice for you. It's completely normal to feel unsure about what to expect and how to make your recovery as smooth as possible. But don't worry, we're here to help you unravel the mysteries of total knee replacements. From the surgery itself to essential tips for successful recovery, we've got you covered. Did you know that around 800,000 knee replacements are performed each year in the US alone? And here's the good news. Most people who undergo a knee replacement surgery report feeling much better after. In fact, studies show that over 80% of patients are satisfied with their knee replacement, making it a real success story for many. Knee arthritis is one of the most common orthopedic causes of disability, causing serious pain that makes moving around challenging and significantly impacts quality of life. For those dealing with more advanced cases, knee replacements have become the go-to solution. But here's the thing, it's not always a perfect fix. That leaves about 20% of people, roughly 150,000 people, who aren't completely happy with their results. This just goes to show that while knee replacements work really well for a lot of people, it's not necessarily the right choice for everyone. But why is that? Well, when it comes to knee replacement surgery, it's all about finding the right candidates, those who will truly benefit from the procedure. But here's some insider knowledge that you should be aware of. Many hospitals see orthopedic surgeries, like knee replacements, as some of their most profitable procedures. Since these surgeries are usually covered by insurance and come with high reimbursement rates, they really boost those profit margins. Did you know that each knee replacement can cost over $31,000? And with so many of them happening each year, it's a bit concerning that hospitals might be sometimes pushing surgery a little too quickly. This can lead to less than ideal outcomes, especially for people who have milder pain and knee OA. So when considering knee replacement surgery, it's key to recognize that not everyone is suitable for this procedure, yet some are pushed to get them when it may not be the ideal time. Because while knee replacements can be life-changing for people with severe arthritis, they do have their limits. Research shows that patients with milder arthritis often feel let down by the results, since they might not notice significant improvements in their function. This is often because despite medical advancements, total knee replacements do not perfectly mimic the biomechanics of a natural knee. This limitation can make it tricky to do activities like squatting, kneeling, or twisting. So if you love staying active, you might find that some of your favorite moves just aren't as easy anymore. That's why it's so important to recommend surgery only to those who generally stand to benefit. To help this, doctors should be using assessment tools to figure out if a patient is a good fit for surgery. Unfortunately, with the huge increases in the number of procedures performed each year, this careful evaluation is likely not happening as often as it should. According to one study, a huge 34% of patients who received a total knee replacement were deemed inappropriate for the procedure, meaning they should not have had it because the potential risks outweighed the benefits. So how do you know if you're a good candidate for knee replacement? Well, lucky for you, a study looked into this and found some clear criteria for those who were appropriate and those who were not. These tools consider several factors: pain levels, functional limitations, age, knee joint mobility, and the severity of degeneration seen on x-rays, rated from 0 to 4. The largest group of people deemed inappropriate for surgery were those with mild to moderate pain and degeneration, rated as less than or equal to 3. This shows us that just because you see some arthritis on x-rays doesn't always mean surgery is needed, especially if the pain is manageable and function is still high. After all, the new knee replacement does not replicate a natural knee, so people come out of it disappointed in their function. Age was also a key indicator, with anyone below the age of 55 strongly discouraged to have the surgery unless their arthritis was severe. So who is appropriate for this procedure then? Well, according to that same study, up to 87% of surgeries deemed appropriate were people over the age of 55 with intense or severe pain and functional limitations with severe knee arthritis. So if you're considering knee replacement surgery, there are a few important points to think about. First, take a moment to really assess your pain and function. Ask yourself whether the pain is truly debilitating and how much it affects your daily life. Remember, just because your x-rays show some degeneration does not mean surgery is your only option. It's crucial to evaluate your symptoms and overall function first. And before jumping to surgery, you should of course explore some non-surgical options. Options like physical therapy, injections, and lifestyle changes can make significant differences. For example, did you know that losing just 10 pounds is equivalent to losing 40 pounds off your knee joint? That's huge. Every bit of weight you shed eases the burden on your knees, potentially reducing pain and improving function. But it's not just about weight loss. Strengthening your muscles around your knees is also very helpful. Stronger muscles help support your joints and keep pressure off of them, making everyday activities more manageable. And let's not overlook the impact of nutrition. Arthritis is an inflammatory condition, and the food you eat can either fuel or fight inflammation. Incorporating anti-inflammatory foods into your diet can help manage your pain and improve your overall health. Plus, staying hydrated is key as it helps keep your joints lubricated. And if you're searching for a comprehensive guide to managing knee arthritis, be sure to grab your free copy of our Knee Arthritis Playbook. You'll find the link in the description below. This ebook is packed with valuable insights, strategies, and tips to help you manage your pain and prevent progression. Don't miss out on this helpful resource. Alright, let's now shift gears and talk about total knee replacements themselves. When discussing knee replacements, it's helpful to understand the knee is divided into three compartments: the medial compartment, the lateral compartment, and the anterior compartment, also known as the patellofemoral compartment. Knowing these compartments really clarifies the different types of knee surgeries available. For people dealing with arthritis or damage in just one compartment, a partial knee replacement is often the better option. This surgery targets either the medial, lateral, or patellofemoral compartment while keeping the rest of the knee intact. It's perfect for those who have localized damage who still have decent function in the unaffected areas. Since it's less invasive, the procedure can relieve pain and improve function without requiring a full knee replacement, resulting in a quicker recovery and maintaining function. But when damage is widespread and affects all three compartments, a total knee replacement is typically recommended. This procedure replaces the entire knee joint, aiming to alleviate severe pain and stiffness while improving mobility. It's usually the go-to choice when other treatments just haven't cut it and knee function is really struggling. While most people who receive knee replacements report excellent pain relief, it's surprising that over 30% of patients are dissatisfied with their mobility a year after the operation, even if their pain has improved after surgery. This could be due in part to inappropriate knee replacement decisions, but also may be due to inadequate rehab after surgery, because research shows that people with knee arthritis often have 20% strength deficits compared to those without it. This weakness can worsen after surgery, with nearly a 50% reduction in quadricep strength after. So not only are patients entering surgery weak, they come out even weaker. And as a result, about 75% of knee replacement patients still struggle with stairs, experience slower walking speeds, and an increased risk of falls long after surgery. But why does this weakness happen? Well, researchers identified two main culprits: muscle atrophy and arthrogenic muscle inhibition, also known as AMI. Muscle atrophy, particularly in the quadriceps, can cause a 5 to 20% loss in size within the first month after surgery. While this contributes to weakness, the bigger issue is AMI, which impairs the ability of the muscle to fully activate. This lack of activation could further reduce muscle mass, following the use it or lose it principle. Given these persistent challenges, it's essential to focus on a proactive rehab approach. But what should your rehab plan look like? Well, building strength, especially in your quadriceps muscle, before surgery is an extremely smart move, as it helps counteract the muscle loss and weakness that often accompany chronic pain and surgery. But don't just zero in on the knee. Many people with knee arthritis also have weak hips, particularly the hip abductor muscles. The hip abductor muscles play a crucial role in contributing to the movement and stability of your pelvis and thigh. Studies have shown that people with knee arthritis often experience significant weakness in these muscles, which can greatly affect how your knee feels and functions. In fact, research indicates that hip abductor strength can be anywhere from 7 to 24% weaker in individuals with knee arthritis compared to those without it. But why exactly does having weak hip abductors matter if you have knee arthritis or undergo a total knee replacement? Well, weak hip abductors can lead to pelvic instability, causing your pelvis to drop while walking. This instability can make your knee collapse inward, increasing the load on the inner knee joint. This inward collapse is one of the reasons why inner knee, also known as the medial compartment, is one of the most common sites for arthritis. Since this area experiences the majority of pressure during daily activity, it can contribute to both the onset and progression of arthritis. And unfortunately, this weakness in the hip abductors doesn't magically resolve after knee replacement surgery. In fact, many people find that their hip abductor strength remains compromised even after the operation. This persistent weakness can lead to continued pain and mobility issues, making it challenging to get around. People often report struggles with activities like walking, climbing stairs, or even standing for extended periods, which can hinder their overall recovery and quality of life. That's why addressing hip abductor strength in your rehab plan is key, not just for knee function, but for improving your overall stability and mobility after surgery. But you might be wondering, what if my knee pain prevents me from exercising? What should I do then? Well, the good news is that there are plenty of ways to strengthen your muscles while keeping your pain under control. Low impact exercises are a fantastic option to consider. Think of activities like machine or non-weight bearing strength training, pool therapy, or using a stationary bike or elliptical machine. These exercises help build muscle strength without putting too much stress on your joints. It's important to remember that you don't have to avoid pain entirely. A little discomfort doesn't mean you're doing any harm to your body. The key is finding the right balance of activity that promotes strength while managing your pain. Because if you try to avoid pain altogether, you're likely to miss out on making real progress. So don't shy away from exercising, just be mindful of your body and find what works best for you. And when in doubt, ask a physical therapist. During this phase, the main focus is on 4 key areas: managing pain, reducing swelling, restoring knee mobility, and enhancing muscle control. To effectively manage pain and swelling, you'll want to use a mix of strategies, including using ice, elevating your legs, using massage strategies, and performing gentle range of motion exercises. Remember, addressing pain and swelling and spasms early on is crucial for mobility. These techniques will help manage muscle spasms, promote relaxation, and most importantly, get you moving again. Sticking to a structured recovery plan, like elevating your legs, icing, using compression sleeves, taking your prescribed pain medications, and doing your exercises is an essential way to reduce swelling and improve knee function while managing your pain. Because the better you manage pain and swelling early on, the easier it will be to get your knee moving. Just as important is avoiding positions that might lead to knee stiffness. For example, don't put a pillow under your knee when you're sleeping. That can cause it to stiffen up. Instead, place a pillow under your calf to allow the knee to fully straighten out, with your toes pointing upward. Consistency is key here. You don't want to be dealing with a stiff knee. One condition you definitely want to avoid is something called arthrofibrosis. This occurs when excessive scar tissue builds up around the knee joint, leading to stiffness and limited range of motion. It can develop if your knee isn't moved enough after surgery or if significant swelling hangs around too long. And trust me, dealing with arthrofibrosis is not fun. So to manage and prevent the complication, keep the knee moving gently but consistently. Incorporating stretching exercises into your routine can be incredibly beneficial. Physical therapists can guide you with targeted stretches and mobilizations to help prevent scar tissue building up. If arthrofibrosis does develop, it may require more intensive treatments, which could include manipulation under anesthesia. This procedure involves forcefully moving your knee while you're sedated to break up the scar tissue and improve range of motion. While it can be effective, it's certainly not ideal, so do everything you can to prevent it from developing. And you might be wondering, when can I finally ditch this cane? Well, it's essential to assess your readiness based on a few key criteria. First, you should be able to fully straighten out your knee so you can take a good stride without limping. Your quadriceps muscle also needs to engage strongly to prevent your knee from buckling. A good test for this is being able to perform 20 straight leg raises without your knee bending. Also, swelling should be minimal, and when you go to walk, there shouldn't be any significant limp. Once you've checked off these boxes, you'll be ready to say goodbye to that cane. After the first 6 weeks after knee replacement surgery, you should be aiming for a few key goals. Your swelling and pain should be well managed and minimal. Your knee should be able to bend to 115 degrees and fully straighten out. And you should have a strong quadriceps contraction. After the first 6 weeks, when your pain is under control and your knee flexibility is almost back to normal, it's time for a crucial shift in your recovery journey. This is when we really start to ramp up the intensity of your exercises. To build strength effectively, you need to challenge your muscles with the right amount of load. A common pitfall during the later phases of recovery is staying too light with the exercises. This can hinder your ability to perform everyday tasks, like getting up and down from the floor or climbing stairs. Because just as pushing too hard too early can slow down your progress, not challenging yourself enough later on can lead to disappointing results. Because it's all about finding that sweet spot, making sure your pain is well managed while you progressively increase the resistance, ensuring that you gain strength over time. Because if you're finding it tough to navigate stairs or get up and down from the floor, continuing with light exercises simply won't cut it. To really see improvements, you'll want to integrate higher intensity exercises with heavier weights into your routine. That's why I strongly recommend visiting a physical therapy clinic equipped with gym style machines. Using equipment like leg presses and knee extension machines is key for your rehab. These exercises specifically target your muscles around your knee, helping to increase both size and strength. By 12 weeks after surgery, you should be seeing some significant improvements. Your pain and swelling should be well managed, your knee mobility should be at its best, and your strength and endurance should be approaching 75 to 80% of the other side. Many people even feel better than they did before surgery by this point and are back to most daily activities. It's very common for people to be discharged from rehab around this time, and that's definitely a positive milestone. However, let's not forget something important we mentioned earlier. Up to 30% of people who undergo a total knee replacement report feeling dissatisfied with their mobility. This dissatisfaction often ties back to ongoing muscle weakness after surgery. So even if your pain is under control and you're able to return to most daily activities, muscle weakness doesn't just disappear on its own. Because just think about it, even if you're at 75 to 80% of strength, there is still a significant gap that can impact your mobility and balance, and these issues can worsen as you age. So it's critical to continue focusing on strength and stability even if you're feeling good. Some people might feel ready to be discharged around this time, and that's perfectly fine, but it's really important to emphasize the need for ongoing progressive strengthening. That's why I often recommend keeping patients engaged in rehab for up to 6 months after surgery to help them truly maximize their recovery. Now, there are some that would prefer to tackle this on their own, and that's perfectly fine as well. But the key is for them to get a gym membership, because again, you need to load your muscles. Your physical therapist can easily provide you with a gym-based program and clear guidance on how to progress your exercises. This support can really help you continue to get stronger. I generally recommend committing to a full year after surgery of strengthening exercises to get the best results. Ultimately, having a structured rehab program, ideally a gym-based program, is key to maximizing progress and ensuring you're loading your muscles properly. And before you wrap up your physical therapy, make sure you can perform all daily activities and recreational tasks without pain, swelling, or any awkward movement patterns. The first year is where you maximize outcomes, so don't give up too early. Do you have any questions about total knee replacement surgery? Feel free to leave a comment below. And if you've had this surgery, we'd love to hear about your experiences as well. And don't forget to subscribe to the channel so you can stay up to date about your body, how it works, and what it needs to keep moving.